Hi, my name is Tragengraf. I'm a junior at Midland University. I am majoring in exercise science with a minor in nutrition. I am interning at Fremont Therapy and Wellness, and today I will be showing you what it looks like on the inside of Fremont Therapy and Wellness. So to start off the video here, you can see what the inside kind of looks like. This is the main area. This is where they'll take the patients out and work with them, help them with their exercises and their rehab. You can see a bunch of tables, see a bunch of equipment in the back, machines, tools to help the therapists help their patients get better. Next, we'll get into some warm-up machines like the bike, the arm pedaling machine. You typically with the bike, you'll see like patients with lower body injuries warm up there. And for the arm pedaling machines, you'll typically see patients struggling with like arm injuries warm up there, like shoulder, elbow, or wrist. Here, we'll get in the leg press machine, along with the squat rack, and then we'll get some dumbbells, kettlebells, some hurdles. There's the sled. You'll typically see patients who are trying to build lower body strength work there. And then here we'll get into the grass turf area. The grass turf area is where you'll see like more athletic movements done, like jumping or bounding, sprinting, stopping and going. Just kind of more of a place where athletes work to help get better and back to their sports. So next video I'll be showing is more of like the grass turf area. There's some force plates there. Force plates are used to help physical therapists determine how much force you're putting into the ground when like walking or doing certain movements. There is the walking rack. Patients who struggle with like walking, like say you're getting straight out of surgery and you like forgot how to walk, they'll typically go there. And then we'll get into the anti-gravity treadmill here, right around the left here. The anti-gravity treadmill. Typically, it's a new piece of technology. The point of it is to provide like partial body weight support using differential air pressure technology. It's a really cool piece of equipment, and I thought it'd be really cool to kind of include in my video. So next, we'll get into the video here showing the aquatic therapy treadmill. The aquatic treadmill is like a low impact, high resistance exercise environment that like uses water or water buoyancy to like reduce stress on the joints. This machine helps build muscle and provides patient like a unique way of getting better. So therapists will typically use this like when a patient is experiencing like a lot of pain while doing exercises. They'll take them here because you put them in water, it'll put less pressure on your joints, and when you do that, a patient will experience less pain. It's also kind of more fun way of doing rehab. Get in the water, get to feeling like a kid again. So I think patients have a really good time doing this one, and therapists I think enjoy doing it well. It's just kind of a unique piece of technology, and to me it's really interesting. I thought I'd include it in my video. And lastly, here we'll get into one of these. This is just like a normal like back room. They'll like do like dry needling here. That's bench they'll do like exercises on. They got stuff in the corner, more tools and equipment. Right there is a place where they'll do dry needling. Dry needling is when they'll take like a needle and stick it in someone in an area, stick it in someone like who's experiencing pain in a certain area. They'll stick the needles in an area, that's experiencing pain, and then that will like cause inflammation. Inflammation, of course, like helps the body heal. So in a way, it's a good thing. And yeah, I mean, this is pretty much. There's a few other rooms just like the one I'm showing currently, but for the most part, they're all pretty much the same. And to conclude this video, I'll tell you like 2 to 3 things I want to learn from my internship. Number 1, I want to learn how to communicate effectively. I want to be able to communicate good because one day of being a physical therapist, you gotta like listen and you gotta like communicate what's going on with your patient. I also want to become more like comfortable, and intelligent, like talking about like the body, like when it comes to like forearms and wrists, like explaining like what muscles are there, because there's so many muscle and bones in the body. And I think it's really important to gain that knowledge and understand like what's going on. And number 3, I just want to like experience the everyday life of a physical therapist, like understand like what I'm gonna be doing one day, hopefully, and experience like what to expect and how to manage the good days and manage the bad days. So that's all from me. Thank you for watching. Bye.